We're here at the Mills and Reeve Mental Health 2012 and Beyond Conference, and Mike Cooke, Chief Executive of Nottinghamshire Healthcare NHS Trust, is with me. Mike, you've been in the mental health business a long time. Another change, CCGs, a threat or an opportunity for you?
Well, clinical commissioning groups are an opportunity for new clinical conversations. I think they could be a threat in the short term. They've got to get up to speed, learn the job, know how to handle the whole system. I think them joining together in commissioning could be quite healthy over time, but I think that's going to take a while. So there's a threat in the short term, but I like clinicians working together. My secondary care clinicians working with primary care clinicians, that's what it's all about. We want integrated healthcare over time.
How do you think it'll affect the people actually in your care on a day-to-day basis?
Well, hopefully there'll be less handoffs. There'll be more ability to join up. If GPs are going to be in control, I like a primary care-led NHS, and I think a lot of us have set up services which allow patients to sort of move past them and past the demand and the filtering that GPs and primary care are very good at. So I think to have that back is good, have real pathways for service users that work, have GPs cited and controlling and managing care pathways across services, I think will work over time.
Sounds to me though GPs are going to need a lot of training and help. Are you going to be involved in that, or how do you see that working?
We already are. I mean, obviously GPs with a special interest in mental health is really good. It's 40% of what GPs deal with, some aspect of mental health. So it's a big part and a big burden. If you look at depression, dementia, diabetes, the 3Ds as they're called, they're going to be huge burdens on the population. And GPs are going to take the brunt of that. We've got to really help out with depression, dementia, integrated care options for people. And whilst I think it'll take a while to settle down, I think there's some good GPs stepping forward. There's also the provider side of GPs, and we need to work with them too. I think there's a lot of emphasis on clinical commissioning groups, but actually it's the provider side of primary care that's really important too. And we're doing quite a lot of inventive work with that now as an integrated provider.
Now, I think you're doing a lot of work with a QIPP programme. What are you doing? How's that going?
Well, quality, innovation, prevention and productivity. I mean, productivity is coming. I'm seeing more patients and driving out 4% cost improvements. We've certainly got a lot of burden in our services, but that's good. I'm not short of business, and that's fine as a foundation trust standard organisation. But I think the innovation's the key thing that gets lost if we're not careful. If we just do more of the same, we're going to run out of money. So I think the innovation is absolutely key. Put the I in QIPP. That's my message.
And finally, not where do you hope we'll be in 3 or 4 years' time, but where do you think mental health services in the NHS will be in 3 or 4 years' time?
I think mental health services in the NHS are underestimated. They're quite a strong bit of the NHS CV now. I think you'll see it consolidate. I think there'll be more standardised practices through NICE guidelines, through a whole range of quality measures. I'm worried about the cash releasing efficiency savings. I think it will be a service of quality, but maybe different quality in time. I think we've got to get rid of the variation that's unexplained. And I think we've got to really motor as a mental health sector. If we do, I think we'll do well.
So it's in your own hands then?
It is definitely in our own hands, and as self-regulating autonomous providers, us providers have got to get on with it, and we will.